Hi, my name is Martha Linares and I'm going to be presenting hepatitis C. Hepatitis C indicates an inflammation of the liver, meaning the liver is damaged, affecting its function. Hepatitis C is a non-sympathetic type of virus that enters the liver and goes under replication, causing cell death by insulin resistance. Hepatitis steatosis or oxidative stress, when the bodies are attacked by the infectious agent. Hepatitis C is an RNA virus belonging to the flavivir family, consisting of the simple stranded RNA and a frame of nucleotides. The origin and development of the disease is through the replication of hepatitis C virus particles associated with the low-density proteins. Hepatitis C is divided into 6 distinct genotypes with multiple subtypes in each genotype class. Genotypes 1, 2, and 3 are the most common in Europe and the Far East. Genotypes 4, 5, and 6 are more common in the Middle East, Africa, and Asia, while genotypes 2 and 3 are more common among those who have used or are using intravenous drugs. The risk of transmission is primarily increased through the exposure to infected blood. Being exposed to inpatient care or clinical laboratory work. Other risks include patients who receive blood transfusions, hemodialysis, or organ transplants are in risk to have been contact with hepatitis C virus. Lastly, cases of possible but less frequent exposures are through sexual intercourse and birth from a mother with hepatitis C. Hepatitis C virus can be acute or chronic, which can last for weeks and eventually become a life-threatening sickness. Patients diagnosed with acute hepatitis manifest mild symptoms after 1.5 months after the exposure, but this can range from 2 weeks to 6 months. Hepatitis C can be acute or chronic, where the virus does not manifest symptoms for years until the symptoms are evident and able to be identified without the presenting or obvious symptoms. Patients diagnosed with acute hepatitis manifest some of the mild symptoms, which can be fever, dark urine, abdominal pain, nausea, joint pain, jaundice. Like I said before, these are symptoms that not all the time are present on the person who is being infected with hepatitis C. The best way to correctly diagnose a patient with hepatitis C is by having blood tests to determine if the case is acute or chronic. Some individuals with acute or chronic hepatitis C show no symptoms, and that's the reason that they have to be blood tested. Hepatitis C antibody blood test is the first test done in a person that is suspected of contracting hepatitis C. The polymerase chain reaction PCR test is the test following a positive antibody test. Will be undertaken to confirm if the virus is still present. Dry blood spot test is used to test some individuals who have been injected drugs in the past. This type of testing, the dry blood spot, is a simple test that requires a small amount of blood to be taken from a single finger prick and is less invasive than a normal blood test. Most hepatitis C treatments are pangenotypic. They are designed of each pangenotypic treatment has certain chemical properties that will work more than one genotype at the same time and have a high rate of efficiency targeting a specific liver conditions, meaning they can be used across all genotypes. It is very important to know and evaluate the severity of the symptoms if the patient are at elevated risk for being infected with hepatitis C in order to keep track of these individuals and provide them with the proper treatment according to the liver damage. Hepatitis C can be prevented, and prevention depends on reducing the risk of exposure to the virus through the people's behaviors, such as injections of drugs and safe sexual relations. Prevention should also be applied to the healthcare settings where the practice of safe handling and disposal of sharp needles should be followed. Also very important for healthcare facilities, following all the protocols for sterilization and for all the treatments provided, either invasive or non-invasive, should be consistent, and people should be very careful when they handle those type of care and those type of treatments. Hepatitis C constitutes a challenge for the general population. People can be infected with hepatitis C by sharing needles or other equipment and being reluctant to receive healthcare services, which is a significant cause of the worldwide death. For some people, patients infected with the hepatitis C virus, the virus can be short-term treatable, but for others, the virus may become a long-term chronic infection, resulting in serious health problems like cirrhosis or liver cancer. Here is the importance of healthcare providers, nurses, social workers, and community services, since we all play a role in the prevention and identification and treatment for hepatitis C. As of right now, there is no vaccine against the hepatitis C, but short-term treatments for hepatitis C can treat and prolong the infection. Thank you, and if you have any questions, you can for sure email me. Thanks.